This is a natural dietary supplement extract from tropical sorghum bicolor, researched, refined and confirmed as a powerful antioxidant.
As far back as 10-11 years ago, we carried out clinical studies using JOBELYN for HIV patients at the military hospital in Lagos, and found out that about 50 or 60 of the patients who were placed on JOBELYN did very, very well. And of course, for the listeners, we need to make this clarification. If you have tested positive for HIV and your CD4 count is above 350, the doctors will tell you that they will not place you on the orthodox antiretroviral drugs.
That is true.
But if your CD4 count is below 350, straight away they will put you on antiretroviral. So the experiment that we did, the clinical studies that we did at military hospital, patients who had CD4 count above 350 were given JOBELYN alone, and the rate at which their CD4 count increased was very, very impressive. Then those who were having CD4 count below 350, they combined JOBELYN with the antiretroviral drug for them, and they also did very, very well. So we also proceeded to carry out similar experiment at the police hospital in Lagos, and all the patients who were placed on JOBELYN, at the police hospital, they only used JOBELYN for all the patients who had CD4 count that was above 350, and all of them became well. Their CD4 count increased, their blood level also increased. And surprisingly, we were just going through the internet last year, and we read a report of an institute
in Tunis.
Yeah, Tunis Gapi
Yes.
Institute.
Yes.
And they have been following the track record of JOBELYN when it was even JOBE formula. So from that report, it was stated that they have used JOBELYN to cure 1,650 patients within 6 months. Of course, we didn't meet them, we didn't know them, but this was a very big publication. So this country is very lucky that we have got a product that will sustain. People who have HIV and their CD4 count is still below, above 350. None of them have been living on JOBELYN. Their CD4 count has been improving. We have not tested them to say that they have become negative, but at least we have records of people who have been on JOBELYN for the past 5, 8, 10 years who have been HIV positive. They have been living their normal lives, and nothing has been wrong with them. They have never been falling ill, and their CD4 count are continuing to increase. So for people who are listening, if you have, you don't need to panic or to fear HIV. If you suspect or that you have HIV, go to the testing center, know your status. If the CD4 count is below 350, consult your doctor. They will place you on antiretroviral. Tell your doctor, and I believe that many doctors now know JOBELYN and they prescribe JOBELYN. Your doctor will also agree that you can combine JOBELYN with your antiretroviral drug if your CD4 count is below 350. But if it is above 350, I'm sure many doctors too will support you that you should be on a daily dose of JOBELYN constantly, and it will sustain you.
JOBELYN now comes in a new pack.
Live healthy, live JOBELYN.